In 2001, the Surgeon General's report on mental health, culture, race, and ethnicity called stigma the most pervasive problem preventing members of all racial and ethnic minority groups from seeking behavioral health care for mental disorders. Several characteristics are associated with the stigma of mental disorders in Latinos. There is a negative cultural connotation associated with mental disorders. Stigma is heightened by immigration and acculturation experiences. The stigma of having a mental disorder is one of the most significant obstacles preventing Latinos from seeking help. Medication treatment heightens the stigma of mental disorders among Latinos. My name is Peter Guarnaccia, and I'm a professor at Rutgers University. I'm delighted to be with you today to guide you through the DVD, No Soy Loco, I'm Not Crazy, Understanding the Stigma of Mental Illness in Latinos. As you will see, the idiom of distress of locura, or serious mental disorder, shapes how Latinos view mental illness. Avoiding the label of locura is critical for Latinos to maintain their self-respect and that of their families. Loco is used as both a noun and an adjective to refer to a person with locura. The overall learning objectives for this DVD are: 1. To demonstrate how the stigma of mental illness manifests in the individual, family, and community in Latino groups. To demonstrate how therapists can empathize with their perspectives of ill individuals and their families. The idioms of distress that individuals and families use to describe their illness, the impact of symptoms on the family members' lives, and the diverse explanatory models and treatment pathways that individuals and families may use. Also to show how the mental health professional can work in partnership with individuals and families to negotiate and implement a treatment plan that is acceptable. The following 3 vignettes provide examples of culturally competent treatment for Latinos. All the vignettes were developed by the psychiatrists who appear in the DVD. The patients are actors, but the content comes from real patients with whom the clinicians have worked. The vignettes have been altered to protect the identities of the patients involved. As you watch each vignette, carefully observe how the clinician works with the social and cultural issues embedded in the story. Pay particular attention to how the stigma of mental illness is managed as part of an overall culturally competent approach to treatment. The vignettes illustrate several themes that resonate through this DVD. One is the meaning of severe mental disorder in the Latino community. While the patients have displayed psychotic symptoms in the past, these symptoms are not always the most important dimension of their clinical profiles. Related to this is the stigma of locura and the desire to avoid that label at all cost. The use of nervousness or nervios emerges as an alternative to these more severe diagnoses for both the family and the clinician. Family relationships and the role of the family as caregiver and protector of vulnerable people are central issues in Latino culture. An additional important theme in these vignettes is the role of religion, both as a social support system for individuals and families with mental disorders, and as a possible source of distorted ideas for those with severe mental disorders with psychotic features. Diego is an 18-year-old Latino male who struggles to bring together the Latino and American aspects of his cultural identity. Born in San Francisco, he is bilingual in English and Spanish. He is tightly linked to his extended family, particularly his mother's family from Nicaragua. His father's family was originally from Cuba. Diego's acculturation as a second-generation Latino must be assessed in order to understand more completely his cultural identity. Diego grew up and still lives in the Mission District of San Francisco, a large Latino barrio, or ethnic enclave, of the type found in many large U.S. cities. Diego has had considerable experience with schizophrenia. His brother, who is 40, has been explicitly diagnosed with schizophrenia for many years. Family members suspect that Diego's mother suffers from schizophrenia as well. Her first husband left the family in the care of his mother's parents because of her bizarre symptoms, and then he disappeared. Since his grandparents died, Diego, his mother and brother, have been living with an aunt. Both Diego and his relatives are torn between seeing his problems as related to mental disorders or alcohol abuse, or both.
Diego, Mr. Salazar, I'm Dr. Barreras. I'm going to be the psychiatrist on the treatment team. Do you remember the events that led to the hospitalization?
I threw their horchata at the wall, and they came and arrested me, so I punched the wall. I'm Jehovah. They're all jealous of me, I know it. They brought me here. I don't know why they brought me here. They can hear my thoughts from a computer in the control room in the nurse's station. It controls a hologram in my stomach.
Are you hearing voices?
Shh. You can hear my followers. Don't you hear them? You're with the bank, aren't you? That's the reason I'm here. My family's giving you my money to keep me in here.
Diego, have you ever been in a psychiatric hospital or taken psychiatric medication before?
No, my Aunt Luce gives me pink pills. They're smart pills. She's a nurse.
Okay, but you haven't been in a psychiatric hospital before?
No.
Okay. And how long has she given you those medications?
About a month ago.
Where'd she get them?
She got them in Mexico.
Those are the ones in your belongings, the Valium and the thiamine pills. Why do you think they're having these experiences, Diego?
Well, someone gave my mom LSD when she was pregnant with me.
Wow. Do you have any idea what you meant by people can read your mind?
I can hear, it's like earth matter in my head. I can't think. I used to help my mom and my brother Hector.
But it's harder now. You can't concentrate as well? Okay.
Our Father, who art in heaven, I am here with my son Diego, asking for his health, to give him strength, and I ask all this in the name of your Son, Jesus Christ. Amen.
I'm sorry to interrupt. I'm Dr. Barreras. You're Jacinta Salazar, Diego's mom?
Yes, yes.
Thank you for coming in. I appreciate that. We're hoping to meet with you and help us plan on the treatment. It looks like prayer is important in your family.
Yes.
How does he look to you? How is he doing today?
Well, doctor, he's a good boy. I love him very much, and I would like for him to go home. Can he go home with me?
Well, we're a little concerned that he's not quite ready, and that hopefully with this meeting, you'll be able to help us in understanding what we'll do to make the transition home better. Do you understand what brought Diego into the hospital?
He was out drinking with his friends, but he said he won't do that again. He wants to go to church with me.
Okay, and one of the things that he's even said and we've noticed is that he's having a lot of symptoms that are bothersome to him. Disturbing thoughts, he's anxious and preoccupied. The medication seems to be helping some, but it's probably something he's gonna have to take when he goes home. Diego, what do you feel about taking the medication when you go home from the hospital?
The pink poison pills, I think the nurses are paying you to keep me on it, aren't they?
Well, I appreciate you letting us know what some of your concerns are. I'm wondering, is there some reason you'd want to go home right now?
Yes, I have a church assembly today, and I would like for him to come with me.
Okay.
Can he go home?
So you have a church assembly. Could you tell me a little bit about how the church or the assembly is important in your family?
It's very important to us because it gives us a lot of peace. And we attend church twice a week. And I think it would do good to Diego.
Okay.
He's
Okay.
okay going with us to church.
Well, I appreciate you letting me know the importance of church and the assembly in his life. And since we do think he has to be in the hospital a little bit longer, maybe we can have the pastoral counselor talk to you, or the church chaplain, work with the team so that he feels more at peace while he's here and helps him transition home and when he's in a better state of health.
I'd like to just go home.
You want to go home right now, Diego? Is there anyone else in the family that could help us understand Diego's life better that's living with Diego?
I have my Aunt Luce.
And your Aunt Luce does she live at home?
She's the owner of the house.
Okay, so you live in her home?
Yes.
Okay, maybe we can talk to her and get some more idea about what's going to be helpful for when you go home. Luce, thanks for coming in and coming in to meet. Dr. Barres, I'm working with Diego, and I just wanted to meet and find out a little bit about how he's been outside of the hospital and also if you can be helpful for treatment planning. But I understand he's living with you. How does he seem compared to how he was before?
I don't know. He's less nervous, but he was shouting something about Satan during dinner, and he did punch a hole in the wall before coming to the hospital. Do you really think that he's stable now with everything that he's been saying and doing?
Well, it sounds like from what you're saying, he's probably a little less agitated now. We've started some medication that seems to be having some effect and seems to be working somewhat. He also met the pastoral counselor today. That seems to be prayer in the church is really important for him. But I wanted to know a little bit about what the living situation is like at home. Maybe you can tell me about that.
So Diego, his older brother Hector, and Jacinta, his mom, they live with my husband and me. Right now, Diego and Jacinta are sharing a room together.
And how long have they lived with you?
Well, originally they're from Nicaragua. Jacinta used to work back then. But after Hector, the eldest, was born, she was never the same. I heard that she started hearing voices, thinking that the neighbors were poisoning her. Her husband ended up leaving her. He dropped her off at her parents' home when Hector was just a toddler. They lived with her parents for about 4 or 5 years. Then they all moved to the U.S. And after her parents died, they moved in with my husband and me.
Okay, so they've been with you for a little while. Has she ever had any psychiatric evaluation or been treated before?
No, no one in the family really talks about it. It's more like a family secret. Maybe that's even why her husband left her, but she's never been treated and she's never been able to work.
And there's a note about his older brother Hector also having mental illness?
Yes, Hector is on antipsychotic medication. He's 20 years older than Diego. He spent some time in a state hospital. He was diagnosed with schizophrenia. When he was about 14 years old, he started getting very paranoid, very agitated. He started hearing voices. He's been with us for about 7 or 8 years. And until recently, Diego has been taking care of him, helping him out, very protective of both Hector and Jacinta. And I'm actually taking care of both of them, Hector and Jacinta.
He has social services?
Yeah, I get paid 10 hours a week for in-home supportive services for him.
And Diego's father?
Diego's dad, he's Cuban. He's never really been involved. It was a very short relationship. Diego actually never met him. They were married for less than a year. Jacinta became very paranoid about him. And Diego never heard of him. I think it was a couple of months ago that Diego called him. But he's never been in the picture.
How has it been for Diego to have his brother Hector back at home?
Hector is stable. It was worse when he was younger. But I think that the main problem is Jacinta. She's up all night shouting.
Wow. And shouting?
Yeah, the family thinks that she has the same illness as Hector does, but she's never been treated. She's up all night shouting, thinking that there's people coming in the house when there's actually no one there.
And when did Diego start having problems?
Diego dropped out of school about 2 months ago. He started going out during the weekends with who knows who. He says that he's only been drinking, and I don't think he's ever done drugs, even though he did admit to smoking marijuana once.
And that's essentially what he told us too, and his urine drug screen was negative.
Mm-hmm.
What does the family think is going on with him?
So the family thinks that Hector's illness is more of a susto or a fright.
Can you tell me what a susto means for the family?
Well, susto in the Latino community is a belief that the soul leaves the body when one goes through a traumatic experience. And Jacinta's first husband was very abusive. He would scare her very badly at times. However, as a nurse, I think that this is more of a chemical imbalance. Hector, for example, has been doing really well ever since he's been consistent with his medication.
So I imagine if the family was worried that Hector's illness was caused by a susto, they're probably pretty concerned about what Diego's illness is and what's going on for him. Given what you said, the symptoms he has, and what sounds like a possible family history of schizophrenia, it would be consistent with an early onset of schizophrenia for Diego too. Of course, we'll have to see.
And what about him staying in the same room with his mom yelling at night?
Yeah, that sounds like it's causing a lot of stress and it can't be helping him any. Is there any possibility that he could move rooms and they could?
Probably. I mean, he could probably move in with his brother Hector.
Okay.
But do you think that Jacinta should be treated?
Well, I really can't say. I haven't evaluated her, and I mean, there are some questions that you brought up, and if it's something that you could involve her with to help her help Diego, I think that she might be interested in getting evaluated. You can ask her. That's probably all that you can do. I was curious, there was a question about whether Diego was involved with the gangs. Was that something that was in the picture for him?
No. No, that's a mistake. I don't know where that... He did have a cousin, though. He did have a cousin who was involved with gangs, but not Diego. I don't know where that report came from.
Okay, it was in the emergency room report. Probably was a misconception. Well, thank you for coming in. I appreciate it. We'll try to
Thank you, doctor.
see what we can do for Diego.
Okay.
Diego, Jacinta, thanks for coming in a meeting. Just wanted to have an update and sit down and talk about how he's been doing, as well as plan, because he's about to go home pretty soon. So thanks for coming in. This morning he met with give you a little bit of an update. He met with the counselor, the pastoral counselor. That seemed to go pretty well. The medications, he's taken them very well. It seems to be helping him. One of the things that's going to be important is that he continue taking them when he leaves the hospital.
Doctor, do they harm him?
Do they harm him? Well, Diego, maybe you could tell us a little bit about how the medication has been going.
Well, I feel less anxious and I sleep a lot more now.
Okay. So they sound like they're helping and that they're not causing a lot of side effects. I understand your older brother, Hector, also takes medication. How does that go for him?
It's going well. He's volunteering at church, and he's also attending the day treatment program that he's in. And he hasn't come back to the hospital ever since.
Oh, well, that's good. That's good. One of the things that we've learned from Diego is that he really looks up to you, really listens to you, and we were thinking if you could encourage him to take medication, even here in this meeting, that would be really helpful. I don't know if you'd be willing to try to do that.
Diego, it's good for you to take your medication. I want you to be well, and the doctor also wants to see you do good.
Yeah, it'll help you stay out of the hospital. And the other thing, met with Aunt Luce. That was very nice. She's very helpful to get a sense of what's been going on at home. One of the things was the stress at night was possibly he can move in with his brother Hector, change rooms. He thought that might be helpful, and that'd be okay.
That's okay.
Okay, good. Well, I think from here it's getting ready to leave the hospital, and you met with your case manager, and she's going to help you get some family counseling. I don't know if you'd be willing to go to some family counseling.
It's fine.
Okay, I think that's going to be really helpful. So, but I appreciate you coming in. I hope you do well. And you'll be able to get back to church and get back to the family. I know that he's been really wanting to do that. So thanks for coming in.
Thank you, doctor.
Diego's vignette illustrates the stigma of having a mental disorder and of taking psychiatric medications. It also highlights how extended Latino families maintain individuals in the community, even when they are quite ill. Both the stigma and lack of knowledge of mental illness and its treatment prevent Latinos and their families from seeking help until symptoms become very serious. Latinos often attribute mental illness to external causes as a way to avoid the stigma of the illness being seen as part of the person. The family attributes Diego's brother's illness to the sustos his mother experienced as a result of her first husband's abuse during her pregnancy. Susto is another idiom of distress that is caused by frightening experience. Diego speculates that his illness may result from his mother having been exposed to LSD while she was pregnant with him. The vignette also illustrates the importance of religion to Latino families. Diego's mother sees his attendance at church assemblies as having a calming effect on Diego. The clinician skillfully uses the hospital's pastoral counselor to provide support to Diego. Among Latino families, several family members may play key roles in caretaking. In addition to his mother, Diego's aunt helps to provide history and to assist with medication adherence. Mrs. Pedroso is a 62-year-old Cuban woman with a history of bipolar disorder. She has a delusion of being romantically involved with her priest. She often has difficulty in the community and at church because she blesses strangers in the street as she passes them, gets into fights with people, and interferes during church services. She believes she has special powers. She has been hospitalized several times for her episodic symptoms. Mrs. Pedroso also has hypertension and diabetes, which are not well controlled because she refuses to see her primary care provider, whom she accuses of trying to poison her. Her justification for this is that the medication her physician gave her for hypertension caused her to become dizzy. Mrs. Pedroso does not view her problems as symptoms of a mental disorder, but she definitely perceives stigma because people shun her. Today, she is brought to see Dr. Resendez by her son, who has threatened to have her readmitted to the hospital because of her behavior and refuses to let her care for her granddaughter.
Hello, Mrs. Pedroso. It's nice to see you again. We haven't met for several weeks and you haven't returned my calls. I've been wondering how you're doing.
My son brought me here saying he's going to take me to the hospital if I don't come here. Because I haven't been taking my medication, but I'm not loca. And I'm in love with Father Nichols, and because he knows that I am the reincarnation of Virgin Mary.
Your son must be very worried if he thinks you need to be in the hospital again. What's been happening?
Someone from the church called him, saying that I'm a loca, that I've been fighting with people. I didn't understand I'm in love with Father Nichols, and I've been busy at night writing letters for Father Nichols, making things for him.
You sound like you've been very busy. Have you been getting any sleep?
I don't have time to sleep. I'm too busy. God has indicated that I can raise the dead. I'm too busy to sleep.
How long has this been going on for?
3-4 days.
Okay. With all that you've been doing, have you had any time to take care of yourself, like eat well, take the medications I prescribe and the other medications for your blood pressure and diabetes?
I don't have time to take medicine. I take natural medicine. I can show you.
What natural medicines are you taking?
I take lecithin, I take calcium, I take a couple of them. Yeah. I don't want to take the medication that Dr. Lopez gave me. They make me dizzy, and they make me fall, and I think he's trying to kill me, and besides, he thinks I have locura too.
Does he know that the medication made you feel dizzy?
No, I didn't go back.
Well, I think if he knew that the medication made you feel dizzy, he might lower the dose or try something different. I don't think he's trying to hurt you. Is there a reason you think he might want to hurt you?
I get dizzy, and he almost because he gave me the medication, I almost fell.
Well, I could call him to let him know what happened if you think that would help. Then maybe he could try something different.
Okay, but don't tell him about Father Nicolas, that we love each other, because that doctor thinks that I have locura too.
I'll only talk with him about the medications. Though I am worried about the arguments you've been having at church and the toll not sleeping is taking on your mind and your body. Have you been feeling tired or sad or nervous?
Doctor, you know I have nervios. But I'm not a loca. I don't have locura. I just have nervios. You know that for a long time.
Well, can you say what you mean by nervios this time?
I get headaches, and I get dizzy, and I get sick to my stomach. People at church are not helping me. They don't believe about Father Nicolas and myself. They don't want to believe that, but it's true.
I know how important the church is to you, so it must be difficult to have all those conflicts.
Oh, God, yes, it is. It is.
And I can't speak for Father Nicholas, though I do wonder if we restarted the medication again, it could help with your nervios and with your sleep.
Okay, but just a little dosage, okay? Not too much. I can try my own natural medicine.
I agree with you taking the natural medicines. I just don't think they're enough for you right now. If they were, then you wouldn't be having the problems you've been telling me about. And we can start with a low dose, and next time you come, we can increase it if we need to, but we'll make the decision together. Is there something else bothering you or that you wanted to let me know about?
My son won't let me see my granddaughter. I've been taking care of her. And now he won't let me because he thinks I'm a loca, and I'm not a loca.
Is that also why you agreed to come in today?
I'm the grandmother. I have the right to take care of her. I don't want her in a center. I can take care of her at home.
I understand how important it is for you to spend time with your granddaughter, but with everything you have going on, like the problems at church, writing letters to Father Nicholas, and making his gifts, you might not be able to give her the attention she needs right now. You know, I think it would be helpful for you to meet with your case manager, because she could go to your apartment. If she sees that you're doing well, she could let your son know, and then maybe he'd be in agreement with you taking care of your granddaughter again.
It would be great if she could. She got me the apartment. She got me housing.
So then let's meet with your son now, and we'll let him know the plan we came up with. That you're going to restart taking the medications, that you'll come back and see me in a couple days so we could see how you're doing, and that you're going to meet with your case manager. Does that sound good?
Mm-hmm. Yeah, I'll go get him.
Mrs. Pedrosa's vignette illustrates the stigmatizing meanings of the idiom of distress of locura and how nervios is contrasted with locura to make her condition less stigmatized so as to encourage appropriate treatment. This vignette also highlights the extent to which religious ideas and meanings shape symptoms of mental disorders for Latinos. The issue of being socially out of control is highlighted in this case. An older Latina is expected to behave with great decorum. Mrs. Pedrosa's behavior clearly marks her in the community as someone with a severe mental disorder. Religious issues are very prominent in this case. Mrs. Pedrosa's involvement with her Catholic church builds on culturally meaningful relationships, but in this instance they are taken to extremes that make them inappropriate. For example, closeness and a confiding relationship with the priest are important, especially to older Latinos who may attend church regularly. However, feeling that one's priest is in love with you without evidence is highly inappropriate and a sign of Mrs. Pedroso's mental disorder. Secondly, blessing people is quite common in traditional Latino culture. It is normal when someone leaves the house to say, "Que Dios te bendiga," may God bless you. What is not culturally normative is approaching strangers on the street to bless them. Mrs. Pedroso highly values her role as caretaker for her granddaughter. One of the most upsetting and stigmatizing aspects of her disorder is that her son will not let her take care of her granddaughter. Mrs. Pedroso's preference for a treatment pathway that includes natural remedies, as opposed to prescribed medications, is quite widespread among traditional Latinos. Medications are often seen by patients and family as too strong and dangerous if taken beyond a few weeks. Natural remedies are seen as gentler on the body. Psychiatric medications are particularly suspect because they are thought to be addictive like street drugs such as heroin and cocaine, rather than like prescription medications to treat medical conditions. Dr. Resendez uses her cultural knowledge to reframe Mrs. Pedroso's medications as helping to calm her nervios. She also recognizes that this may make taking the medications less upsetting to Mrs. Pedroso. Dr. Resendez's knowledge of cultural idioms allows her to destigmatize Mrs. Pedroso's illness and convince her that medications will help relieve the symptoms that are most troubling to her.
Leave me alone! No! Leave me alone! No!
Carmen is a 19-year-old Mexican-American female who was brought to the psychiatric emergency service of a public hospital for the third time by her mother and sister, who said she was acting in a bizarre manner. She was not sleeping and was walking on all fours in her room, barking like a dog when we said anything. Carmen was placed on an involuntary commitment and admitted for a psychiatric evaluation. The presentation at the time was bizarre behavior and getting into arguments with her mother and older sister. She had also been smoking marijuana daily. She had a second hospitalization at age 18 with a similar presentation. On those occasions, she was placed on antipsychotic medication with rapid resolution of her symptoms, and she continued to take the medication for only 1 week after discharge. She did not have any follow-up. She had functioned well after each episode, obtaining her GED and doing well in a part-time job at a local fast food restaurant. The patient was not on medication at the time of admission.
Hi, Carmen. I'm Dr. Rodriguez, and I'll be your psychiatrist here in the hospital. I'll be asking you a few questions to find out what were the things that led to you being in the hospital. I wonder if you can fill me in on what happened. I can see you're very upset. What are the tears about? Can you say anything about what you're feeling right this minute? What's been going on at home?
I live with my sister and my mom. My mom has a boyfriend. He molested me when I was 12. He tried to touch me.
You mean touch you in a sexual way?
In a sexual way.
I see. Were you ever able to tell anybody about it at the time?
I saw the counselors at school. I was getting into fights. There was an investigation, and they made him move out. My mom didn't believe me, but it was the truth.
Okay, so was it Child Protective Services that was involved in the investigation?
It was.
Okay, and they made him move out at the time.
And now she wants him to move back. And I just don't trust him.
Okay. So is that what you and your mom have been arguing about the last few weeks? I see. Okay. That helps me understand things a little bit more. Your family also mentioned that you were acting kind of strangely at the time they brought you to the hospital. What can you tell me about that?
I was upset. I had met up with a friend after work and she had a joint. I don't know if it was laced with something. I hadn't smoked for 3 years.
I see. So when you were 16, when you were hospitalized that first time, you had smoked weed just before you got hospitalized? And then this time as well, you'd been smoking in the last day or two before you got hospitalized as well?
Yes.
Okay. That helps me understand things a little bit better. Okay. Just thank you both for coming, and we would like to use this time to think a little bit about what would be most helpful to Carmen and to make some sense of some of the events that were going on in the couple of weeks or days before she was hospitalized. I wonder if you could fill me in on that.
Doctor, when she was 16, she was behaving very strangely as well, and she was hospitalized, and the doctor considered that she was schizophrenic. But she took her medicine and was okay for some time, and then she stopped and she looked okay, so I didn't bring her back into the clinic. You know, you don't talk about those things. But lately she's been so hard-headed and arguing with me on a constant basis. This has been going on for about 2 weeks, and about 3 days ago when I came back from work, she was barking and I called 911 because I didn't know what to do. You think that schizophrenia has come back?
Well, first of all, I think you did exactly the right thing in calling 911. That must have been very frightening for all of you. And I'm not sure about the schizophrenia part, but we can talk about that in a second. One of the things that's come up in our assessment with Carmen is that she brought up that part of what you all have been arguing about is the possibility of your boyfriend moving back into the home. And apparently, when she was younger, there were some allegations that were investigated by Child Protective Services regarding the possibility of a molestation, sexual molestation. And we think some of what's going on may have something to do with that.
Here we go again. That was a long time ago, doctor, and she has always tried to make me go back with her dad, and that's the reason why we've been arguing so much lately.
I see.
Wait a second, Mom. He tried something with me too. He tried to kiss me in a really sexual way. I told him to stop, and he did, but after that I needed to stay away from him.
Wait a minute. You never said anything. You never said anything.
Didn't you notice I was always at my friend's house? And the way you reacted when Carmen told you, I didn't want to say anything. I didn't want to get in trouble.
So, sounds like there's a lot to talk about. And another thing that was brought up in our assessment of Carmen was that she had also been smoking marijuana in the few days before she was hospitalized, which I believe may have had something to do with her bizarre behavior. And I think that that in combination with the difficulties that you've had communicating with each other, she's had difficulty telling you how scared she is about this possibility of Hector moving back in after feeling safe with you for so many years. And I know this has to be really hard for you too. I wonder what it's like to evaluate the family history in light of this new information that Aracelis provided.
We had considered the possibility, and during the investigation of the allegations, nothing was ever proven. So how can he could have been such a big liar?
Sorry, Mom, but it's true. It happened.
I believe you. I believe you both.
So maybe this can be a new beginning for all of you as a family to begin to review your family history together and follow up in some family therapy after Carmen is discharged from the hospital.
They're my babies. I believe them.
Yeah.
In the initial hospitalizations, several important aspects of the history were not elicited, especially that the patient had accused her mother's boyfriend of sexually molesting her at age 12. This accusation, made to the school counselor, triggered an investigation by Child Protective Services and resulted in the boyfriend being banned from the family home and from having contact with the girls. Other stressors at age 16 included some sexual experimentation with her then boyfriend. Given her good inter-episode functioning without the benefit of medication, the diagnosis of a persistent psychotic disorder may have been premature. The intermittent use of marijuana needs to be considered in the differential diagnosis. Alternative diagnoses may have included PTSD, adjustment disorder with disturbance of conduct and emotions, brief psychotic disorder, or substance-induced psychosis. In this family, with a high level of acculturation, the stigma of the diagnosis of a mental disorder competes with the stigma of accepting a disclosure of sexual abuse, even when an investigation has ruled such abuse likely. In this case, the stigma of schizophrenia led the family to minimize the seriousness of the diagnosis and not be invested in follow-up care. During the third hospitalization, we witnessed a conflict between facing the stigma of a mental illness versus the stigma of the disclosure of the abuse. The mother's failure in her culturally prescribed role as protector is another element that may have contributed to the earlier lack of follow-up. The older sister's firm assertion backing up the patient finally cracks the mother's denial about her boyfriend's abusive behavior. As we have seen in these three vignettes, it takes culturally competent knowledge and skills to manage the stigma of mental disorder among Latinos. These issues are heightened by mental disorders that present with psychotic symptoms, such as locura, which is so highly charged and stigmatized among Latinos. The clinicians negotiate these idioms of distress with their patients, focusing on nervios and nervousness to lessen the stigma of the diagnosis. They also sensitively negotiate the use of medication, which can be critical to helping patients cope with their symptoms and reintegrate into their families and communities. The vignettes make clear that there are no simple formulas for how to think about Latinos and the role of culture in coping with mental disorders. These vignettes also illustrate the diversity among Latinos. Gender, age, generation, sex roles, acculturation, religious and spiritual beliefs, and mix of Latino cultures all figure in important ways in these cases. Knowledge about Latino cultures provides an important framework for understanding how to manage mental disorders in the Latino community. Mental health providers need to approach each person with an open mind and learn from and with their patients about the cultural issues that are most important in their lives.